Okay, creating privacy. Hi, my name is Alina. I'll be a nurse today. Today I'm going to be doing a quick assessment for your hair, skin, and nails. So that should take about 3 to 5 minutes just to get an overall look at your health for hair, skin, and nails. Um, is that okay? And the patient state that it is fine. So for today, I would just be doing inspecting and palpating. So inspecting, I'm just looking. So I'm just looking for any abnormalities. And as far as palpating, I'll just be using the dorsal part of my hand just to feel to see if I feel any abnormalities. Is that okay? The patient says they're comfortable with it. Okay, so we're going to start off with two identifiers. Can you give me your name and date of birth? Okay, and looking at the armband, the patient states the correct name and date of birth. All right, so first we're going to start off with the inspection of the skin. So I'm just going to look. So if you can just punch your arms out for me, okay, and then turn them over. And the patient does what I asked them to do, okay. And can you do your legs the same way? So just have them out for me as far as you can. All right, and then turn them over. Okay, so now I'm going to do the palpation part where I use the back of my hands just to feel for anything. So I'm just going to use the dorsal part on the top of your arms and the bottom part. And I'm going to do it for your legs as well. So the top part of your legs and the bottom part. Okay, and for the patient, their skin is intact, it's smooth, it's even distributed, and it's appropriate to race. It's warm and dry. I don't know any wounds, lesions, incisions, or any abnormalities at this moment. Okay, and as I palpate the skin, it is warm and dry. And so now we're going to do skin turgor. So I'm just going to pinch a piece of skin by the clavicle just to check for dehydration. Is that okay? Patient said that is fine. So I'm just going to pinch this part a little bit and then let go. Okay, and it retracts back down, so it shows that the patient has no dehydration at the moment and their skin is elastic. Okay, so now we're going to do the inspection for nails. So if you can just show me your nail beds for your fingers. Okay, and your toes. Okay, and so as I'm looking at the patient's nail beds, they are clean and smooth and with a slight curve. For like 160, it shows like the diamond part, so I don't see any signs of clubbing, and it is appropriate to race. All right, so now I'm going to do the cap refill. So I'm just going to pinch the nail beds really, really lightly just to see if the pink tone come back fast. So I'm just going to touch here. Is that okay? Patient state that is fine. So I'm just going to touch each nail bed for cap refill to see if it comes back within 2 seconds, and I'm noting that they are coming back within 2 seconds. If it's over 2 seconds, it will show that the patient has poor oxygen, um, which is a result of hypoxemia. All right, and it is coming back within 2 seconds. Okay, and as I'm assessing the patient, I don't note any ridges. The nails aren't brittle; they're smooth, and I don't see any signs of clubbing. Okay. All right, and I'm going to inspect and I'm going to assess the head. So I'm going to be looking and touching. Is that okay? And patients state that it is fine. So as I'm looking for lesions, wounds, cuts, incisions, edema, and I don't note any of that. If it is, at this time I will use gloves to see if I see anything. If I see any lesions, I would use gloves and then further inspect. And I don't know any of that at this time. The patient's hair is blonde, is thick, and is straight, and it's appropriate. I don't know any hair loss at this time. Okay, and so I just want to inspect the face. Is that okay? So just look up at me. All right. right, so the patient face is symmetrical. The eye, everything for eye level, the nose, everything is appropriate. The patient's facial expression and mood is appropriate for the situation. Um, I don't know any facial drooping. I just want to ask about the brown part above the eye. Is everything okay with that? And the patient note that it is a birthmark, so that is normal. Okay. All right. So that is it for the hair, skin, and nails. Are you in any pain at this time? And the patient state that they aren't in any pain. Do you need anything, water or your bed lowered? And the patient state that they want their bed lowered. So at this time, I will lower the bed, and I will bring the call light. So the call light will be in arm's reach. Just press the button if you need anything else for me. And I want to thank you for your time today. And then hand hygiene.